How effective are cortisone injection?
Very, actually. Cortisone is a very powerful medication that you can inject around the tendon, and it will cause the swelling to go down. It'll improve the symptoms, alleviate the pain in a matter of a few weeks, maybe usually 7-10 days. It's best performed under ultrasound by someone who is trained to do so for better accuracy and efficiency. The problem is that often symptoms will recur after an initial relief of about a few weeks to sometimes a few months, but it is rarely a permanent treatment. So nowadays we have minimally invasive procedures that can actually provide a permanent cure. Back in the days we used to use a lot of cortisone because the surgery was very invasive, but now I believe there are better techniques to treat this permanently.
Is there a surgical solution to this?
Yes, there is. The purpose of the surgery is to make room for the tendon so that there's no more mechanical conflict. And basically the old traditional technique implies opening the palm, cutting the skin, the subcutaneous tissue, all the way down to the ligament that's forming the roof of this canal. The purpose is to make the canal wider. Now there's a less invasive way to do this, where you just do 2 little keyhole incisions in the palm, and then you get inside the finger with a camera and a little cannula, and you can see the ligament that's causing the obstruction, so to speak, and you can cut this ligament under direct vision, and then you get out of the hand, and there's no incision in the hand, there's no stitches, there's much less swelling, less pain, and with a obviously much faster recovery.
What are the differences between the 3 techniques?
Well, first and foremost, the open procedure is a more aggressive surgery where you have to cut open the skin, the subcutaneous tissue, and everything else that you need to cut so that you get to the ligament. That's the real target of surgery. The other options are less invasive, and the needle technique is where you use a needle to poke through the skin and basically rupture that ligament without opening the hand and without seeing the ligament. So it's a blind procedure, and the problem with that is that you can often injure the tendon, which is why I don't really encourage that technique, especially now that we have a brand new operation, which is an endoscopic trigger finger release, where everything is done from the inside. So it's an inside job done through 2 little keyhole incisions. We get inside with a camera, we see the ligament very clearly, and then we can cut that ligament and that ligament only. So the diameter of the canal is made wider, no more conflict in the tendon, and you don't need no sutures, no dressings after 24 hours, and the patient has almost immediate use of the hand. So I think that's really groundbreaking and better way to treat trigger fingers permanently.